Hello, I'm Dan Diekema, the Director of the Division of Infectious Diseases and the Associate Hospital Epidemiologist here at the University of Iowa Hospital. Today we're going to be talking about standard and isolation precautions. Why should you be concerned, you ask? Because these precautions protect you, your coworkers, our patients, and visitors against the spread of infection. First, we'll be talking about standard precautions. You should use standard precautions in caring for every patient, regardless of that patient's diagnosis or whether that patient has an infection that you know about. A crucial step in standard precautions is hand hygiene, which is the absolute cornerstone of infection prevention. Standard precautions also requires the use of personal protective equipment depending on the tasks that you're performing. For example, if you're drawing blood, you need to wear gloves. Other tasks might require wearing a gown, a surgical mask, or eyewear. All of these will be covered in detail during this video. In addition to standard precautions, we have what we call isolation precautions. There are 3 categories of isolation precautions, and each one involves a different sign on the door to the patient's room. I will show you an example of each of these signs. The most frequently used form of isolation precautions involves this orange sign, which is for contact precautions. This sign and these precautions are used when a germ is transmitted by direct or indirect touch, such as touching body fluids or touching equipment in the patient's room that might be contaminated. A certain type of germ, called Clostridium difficile, is also listed under contact precautions and is indicated by this pink sign. If you see this sign, this means that staff must use hand gel or foam when entering the room, but must use soap and water when exiting the room. The next type of isolation precautions is designated by this green sign, which is for droplet precautions. Droplet precautions are used when a germ is transmitted by big droplets in the air that settle quickly, such as when a person coughs or sneezes. And finally, the last type of isolation precautions is designated by this blue sign, which is for airborne precautions. This means that a germ is transmitted by small droplets that travel for long distances in the air. Because these are small enough to remain airborne for a long period of time, airborne precautions involves special rooms that have different air handling capabilities. Now you will see scenarios that illustrate implementing every one of these types of isolation precautions.
Let's discuss contact precautions. Contact precautions are infections that are spread by direct or indirect contact, such as touching any body fluids or touching the equipment in a patient's room. Patients diagnosed with C. diff, VRE, and MRSA need to be placed in contact precautions. Let's watch a scene where a nurse is caring for a patient in contact precautions for C. diff. See if you can identify what goes wrong in this situation.
Hi, Mrs. Johnson. I'm your nurse today, and you're going to go for an x-ray. So I want you to get ready. I bought you a cap to put on, some gloves, a mask to put over your mouth and nose, and a gown. Okay? If you need any help, just let me know.
Okay. While it may seem like the nurse was being careful by putting on all PPE, contact precautions only require hand hygiene, gown, and gloves before performing patient care. In this case, the nurse was preparing the patient for transport. The patient should wear a clean hospital gown or robe and wash their hands before exiting the room. The nurse should notify the receiving department of the patient's isolation status and wipe the patient's bed rails with bleach wipes. She should also remove all PPE and wash her hands before leaving the room. Let's watch as she does it the correct way.
Hi, Mrs. Johnson. I'm your nurse today, and the doctor wants you to go for an x-ray.
Okay.
So we're going to get you ready to go, okay? First thing I want you to do is wash your hands. Yeah, and I can see that you have a nice clean gown on.
I just put it on.
Okay, that's great. We're going to wipe off the handrails before we leave the room.
Okay.
Okay, with a bleach wipe.
Okay.
And then we'll be on our way.
Okay.
All right.
This person is orange contact precaution room. Looks like I'll be using bleach wipes.
That was much better. We also added the environmental service team member at the end to bring your attention to their role in isolation precautions. It's important to note that for cleaning rooms under contact precautions, EVS must clean with bleach wipes to account for some organisms' ability to live on surfaces for hours. The next type of precaution is droplet precautions. Droplet precautions are needed when germs are spread by big droplets in the air, such as when a patient sneezes or coughs. Examples are many respiratory viruses, influenza, and influenza-like illnesses. Let's take a look at a situation where a respiratory therapist goes in to see a patient in droplet precautions. See if you can identify what is being done wrong.
Good morning, Mrs. Green.
Hi.
How are you feeling today?
Oh, pretty good. Got a cough.
Did you notice that the respiratory therapist did not perform hand hygiene or wear a mask before entering the room of a patient in droplet precautions? By doing this, she's putting herself and others at risk. Let's watch as she does it the correct way.
Oh, goodness. Good morning, Mrs. Green.
Hi, how are you?
How are you feeling today?
A little better. Still have this cough.
Oh.
The last type of isolation precaution is airborne. Airborne precautions are needed when germs are spread by very small droplets in the air. Examples include TB, chickenpox, and measles, among others. Patients must be placed in a negative air pressure room, and staff must wear an N95 respirator or PAPR when entering a room. Let's look at a scenario where a nurse interacts with a patient who has TB.
Hey there, Miss Johnson. I heard your call light going off, so I wanted to go ahead and silence it. Is there something I can get for you?
I'd like some water, please.
Okay, I'll just be right back, okay?
What did you notice in this situation? The nurse did well choosing the correct PPE, but she took off her N95 while she was in the room. By taking off her N95 before leaving the room, she put herself at risk because she was exposed to TB. Let's watch again as the nurse does it the correct way.
Hey there, Miss Johnson. I heard your call light going off. Can I get you something?
Could I get some water, please?
Absolutely. I'll be right back, okay?
Okay.
In summary, you've learned now about standard precautions and the three types of isolation precautions: airborne, contact, and droplet. Some extremely important points to remember. Hand hygiene is absolutely the most important way to prevent infection in the hospital. Second, when wearing gowns, make sure that you secure them. Don't let them hang loose around you. And please do not reuse gowns for isolation. Third, wear a mask if you are coughing. Fourth, think about the tasks that you'll be performing before you enter a patient's room so that you make sure that you have the right personal protective equipment. Fifth, remember, isolate the germ, not the patient. Thank you very much, and remember, infection prevention is in your hands.